State Senator Kathy Young is our guest today. Senator, thanks for joining us.
So glad to be here.
Senator, you're on the Senate's Joint Task Force on Heroin and Opioid. There were hearings about those drugs held by the State Senate back in May and June. Wondering if you could tell us, what did you get out of those hearings?
Well, this continues to be a crisis across all of New York State and actually across the entire country. We've seen such a spike in heroin abuse and opioid abuse, and it's really kind of stems back to an overprescribing of prescription drugs, painkillers, and so now people have turned to heroin, and it's a tremendous problem because it cuts across all lines, all demographics, and there's so many heartbroken families today because a loved one has died from an overdose. And, you know, a friend of mine, his 30-year-old son recently passed away, and their family is just going through so much, and so many families are. So that's why we put together the task force in the Senate on heroin and opioid abuse, and we've traveled across the state. We actually had hearings last year. We're able to get a lot of great information past the package of bills, and now we have a new round this year, and there's more to do. And, you know, a lot of people say, well, it's tougher law enforcement going after the dealers, and that's absolutely correct. You have to go after the people who are dealing the drugs, but at the same time, you need a comprehensive program of prevention and treatment, and that's what our legislation is focused on.
You know, you told Chautauqua Today back in an April interview that there was going to be over $300,000 from the budget to help with just that. The addiction center over in Jamestown, I believe, was where it was going towards. And the way Chautauqua Today phrased it, it was less addicts in the county jail and more addicts getting help for their addiction problems. Do you see that idea of less jail time and more treatment becoming a statewide policy so that there's less incarceration?
I do. I don't think that there is a system in place necessarily that is the best system to address this crisis. And, you know, in the 2015-16 state budget that we passed earlier this year, we provided significant funding for programs that are targeted at addressing the heroin crisis. We put $7.8 million in funding for statewide prevention, treatment, and recovery services, and allotted $450,000 to purchase the Narcan kits that bring people back if they have overdosed. And also, we do training programs for nurses, first responders, staff, to be able to administer the Narcan. But one of the things that I got was a grant to do a pilot project, and we hope that eventually it could be a model program for the rest of the state. And we would do that in Chautauqua County because what we see across the state is that our jails are actually filled with people who are addicts. And there's really nowhere else to put them. They get in trouble. They're, you know, committing petty theft or whatever to support their habits. And I think treatment is a much better option to go. So we're going to do this model project. It would actually be able to give treatment, so if people do have to have a jail sentence, once they get out, they can go right into a treatment program. And I really feel good about this because what's happening is there's quite a burden on the taxpayers because people are inappropriately in our county jails. There's overcrowding in many cases across the state. And so it's not an optimal situation. We need to tackle it.
Wanted to ask you some Common Core questions. First, NYSUT is against the idea of former New York State Education Commissioner John King becoming the head of the Education Department in Washington. That's largely because of the way that King's rollout of Common Core went. What are your thoughts on NYSUT's objections to John King getting the state education job, taking over for Arne Duncan in Washington?
I fully agree that John King is inappropriate to lead the nation's education department. His time in New York State really was not optimal. You know, the rollout of the Common Core was a disaster. It was not well planned. It was not well thought out. It really was detrimental to the kids because overnight they were actually being asked to change their whole paradigm on how they address school. And so as a result, there was a lot of confusion, there were a lot of tears, there was a lot of anxiety and stress, frustration for the students, for the parents, and for the teachers. And so it's really kind of eye-opening to see that President Obama has chosen him in the new role, and I just think it's inappropriate based on his track record.
What's the latest on Common Core reforms coming out of Albany?
Well, I think it's positive. Governor Cuomo has basically pushed the reset button, which I think is very positive. I've had a lot of concerns as to how this was implemented, and so there's a task force that he is setting up that will do a full examination of Common Core, and there are chairs of the Senate and Assembly Education Committees included, but also there are other people who are on the front lines of education that I think could give a lot of good input about what to do. This past year in the Senate, Republicans actually pushed very hard for reforms. We felt very strongly there was too much over-testing. There was the jeopardization of people's private data, their background information that was being sold to a third-party entity called In Bloom. There are all kinds of issues that we're swirling about, and so we tackled a lot of the reforms. We're able to, for example, mandate that the testing had to be reduced. I think it's very positive that Pearson, that was the company that was the author of the testing across the state, basically has been dumped by New York, and there's a new company coming in. So I think there are some positive changes going on. And look, we need to have the highest education standards for our children, for their learning opportunities, for their future. But Common Core so far has been a disaster, and it's really because of how it was managed. And there are a lot of issues also surrounding what was on the testing materials and what some of the content of the lessons were. If we can change all those things and still have higher standards for our kids and allow our parents to be involved and allow our teachers to have input, then I think we're further ahead.
We can do another education question. Campbell Brown, the former CNN personality, her anti-tenure lawsuit against the state education department. What are your thoughts there, Senator?
You know, I support tenure for teachers. I think it's important that we have tenure in place. There were some changes to the tenure system that were implemented. There were proposals from the governor. I thought they were too draconian, but there are ways to actually remove teachers that are not performing. But it's a process, and it should be a longer process. It should give due process to teachers. But at the same time, if someone, for example, is a sex offender or is a criminal in some way, they need to be removed from the classroom right away. And prior to this time, sometimes those issues were arising. There was something in New York City called the rubber room, where they put teachers who could not be in the classroom, and they were having trouble going through the process of eliminating those teachers from the schools. And as a result, these teachers that did not belong in the classrooms were spending time in what they call the rubber rooms. And, for example, there's one teacher who actually was in the rubber room for about 10 years, spent that time getting paid more than $1 million by the taxpayers, and on top of it earned his law degree while he sat there. So those kinds of things are inappropriate. I believe we've made the reforms necessary to get rid of those egregious situations. But I have to say that in most cases, our teachers are doing an excellent job, and I believe that they do deserve and need the protections of tenure.
Senator Young, you secured a $1 million grant to get a biorefinery commercialization center starting at Alfred State College. I think that was at the Wellsville campus. Can you tell us about that?
I am so excited about this initiative. And, you know, when you look at economic development and growth and trying to secure more jobs, you have to look at what are your strengths. And obviously, when we look around the southern tier, we see that one of our strengths is the timber industry, and it's historically been an economic driver for us. Obviously, we want to harvest timber in a very responsible, green way, and we're able to do that. But this new initiative I believe could bring all kinds of research and jobs and economic opportunities across the southern tier. We're looking to establish a program at Alfred State College, Wellsville campus. And basically it's taking this science that's been developed by researchers at the SUNY Environmental Science and Forestry College, which is located in Syracuse. And they've come up with this revolutionary, very exciting method called hot water extraction. And basically what they can do is use this process to extract useful chemicals from wood to make things like biofuels, butane, methanol, all kinds of things. But also they can do other cutting-edge things, such as coming up with biodegradable plastics. And think about that. We are always so concerned about plastics filling up our landfills. And if you came up with a biodegradable plastic that would break down, it would be a major step forward for the environment. So we're working on this very diligently, and I'm hopeful that we're able to secure even more state funding, some federal funding for the project so we can really launch it.
You also helped get $50,000 in funding to the Cancer Center in Allegheny County.
You know, this is such a critical issue, and I feel very good about this. You know, this is an initiative that actually saves lives. When you look at all the different programs, and there's so many worthy programs in New York State, but this one detects cancers and gets people treatment. And I think there's no greater issue than this, because so many lives, so many families are affected by the scourge of cancer. And in rural areas like ours, access to health care can be very, very difficult in many cases, and oftentimes people may have symptoms, they may not know where to turn, they may not get to the doctor on time, and as a result, the cancer is spread, and oftentimes there are bad results. So what we're trying to do is get a system in place, and what we have done is fund this cancer services, and it's been very effective so far, because at the press conference the other day, we had a woman who testified, and she actually was from Salamanca, and this program helped her get treatment so that she could actually beat cancer and survive and be there for her children and her grandchildren. And that's really what it's all about.
We're talking with State Senator Kathy Young. Governor Andrew Cuomo is calling for gun control nationwide since last week's shooting in Oregon. We'll talk about that and the SAFE Act when we get back. Back on the Newsmaker show, Brian O'Neill on with State Senator Kathy Young. Senator, the first thing that happens after the shooting incidents like we saw in Oregon last week, the Democrats will say that more gun control is needed, and the Republicans will argue no, it's not. So when you see the kind of violence that happens in schools and you hear the arguments back and forth, one argument coming from the Democrats who say things like Chris Harper Mercer's guns were all bought legally, some of the weapons he owned, some by his family. And then the Republicans will argue things, for example, like the news story about the member of the Air Force who just happened to be home and outside the school there in Oregon and tried to get in and was armed. And he asked school officials if he could go in. They said no. And there are other arguments that, if a teacher had a gun on the school property, these things wouldn't be happening. What do you say to the arguments for more gun control?
Well, I believe that you should not infringe on the rights of law-abiding gun owners. And look, my heart goes out to the poor families and the victims of that terrible violence that occurred. But what we see in all of these cases, these mass shootings, are three common themes. First, some are due to terrorism, and a great example of that is the shooting that occurred at Fort Hood. And, I think that when you look at that issue, there were warning signs about that particular individual who committed the crime that were left unheeded. So you have to address terrorism, obviously. The second component has to do with gang violence. And we have a tremendous problem with gangs, especially in urban areas across the country. And you see, for example, in Chicago, where they have basically no access to guns for law-abiding citizens. At the same time, they have one of the highest murder rates in the country due to gun violence. And it's really committed by gangs, and I think that you have to go in through law enforcement and try to address this gang violence that has been such a problem. Unfortunately, we see now that stop and frisk has been eliminated in New York City, an incidence of higher murder rates in New York. And that's just down in the city. And again, they limit access to guns for law-abiding citizens, but at the same time, if they relax how they're addressing the gang issues, I believe that there's a really good chance that New York could slide back into the bad old days of a lot of violence in the city. So you have to address the gangs. And then the third element, and this really is in so many cases of these mass shootings, is that there's an unaddressed mental health issue. The person who is the perpetrator generally has serious mental illness, and is violent and dangerous, and unfortunately it goes untreated. And we see this so many times, not only in New York State, but across the country. But I've done a lot of work in this issue. Mental illness, mental health is one of the issues that I believe is severely unaddressed in New York State, and we need to do more to tackle that. You know, the pendulum swings on these issues, and a long time ago, people were committed to psychiatric institutions, oftentimes unnecessarily unwarranted. But we started to see institutionalization, and the pendulum swung the other way. And as a result, there's a real lack of services, and you see it with the homeless populations that we have. You see it with people not being able to get mental health services. And then you see it where there's these incidents where people knew someone was dangerous and violent, but no one was able to do anything. And so that needs to be addressed. That's one of the big issues. It's like the elephant in the room, and we need to go after more treatment. And one of the things that I've done over the years is sponsor and pass Kendra's Law, which addresses this issue. You know, in New York, in so many cases, and we saw it in places like Webster with the Christmas Eve shooting a few years ago. We saw it, actually in places like Newtown and Virginia Tech and all those mass shootings, Columbine. There were perpetrators who had severe mental illness that went untreated. And so with Kendra's Law, basically, if someone is a danger to themselves or others, then they could, through the courts, be put into an assisted outpatient treatment program so that they get the services that they need. And when that happens, the outcomes are great because it's better for the individual. They're finally getting the help that they need. And it's better for the community because the community is protected. It reduces incarceration, suicide, violence, the whole thing. And unfortunately, we can't get Kendra's Law strengthened to the point where I think it's necessary because we've been blocked by the Assembly Democrats. But I think that treating mental illness, and especially for people who are a danger to themselves or others, is key to reducing this gun violence.
Kendra's Law, and you can refresh my memory, Senator Young, if I'm wrong, is that the one with the subway incident where the mental patient pushed the woman in front of a subway and she was killed and a train was coming in New York City? Exactly.
In the year 1999, Kendra Webdale from Fredonia was living and working in New York City. She was just a bright, vivacious young woman in her early 30s, was waiting on a subway platform. And this person named Andrew Goldstein came up behind her. He had schizophrenia, and he pushed her in front of the subway train and killed her. And after that, her family became very active and demanded some action out of Albany. And I remember them in the back of the Assembly chamber because I was in the Assembly then while we passed Kendra's Law. But the Assembly would only agree to kind of a watered-down version of it, and we have strengthened it somewhat over the years because I pushed really hard on that, and I've authored the changes. but there's still cracks and loopholes that need to be fixed. But that's the point, though. You see this random violence that occurs. It's not just with guns. It's pushing people in front of subway trains, and we've had several incidents over the years, time after time in New York City. We've seen cases, for example, in New York City, there's a case that the person was just deemed unfit for trial, but his nickname is the Butcher now. He was in state prison, was released, and was mentally ill, did not get follow-up treatment, unfortunately. And one of the first things that he did was get in an elevator in a housing project in New York City and murder a little 6-year-old boy and severely slash a little girl. He had a knife. And the little boy and girl were on their way to get ice cream. And his name is St. Hubert, his last name. And so it just shows he had untreated severe mental illness, history of violence. There's no way that person should have been out on the street.
State Senator Kathy Young, our guest today on the Newsmaker show. Brian O'Neill filling in for Kevin Dorn. Governor Cuomo seemed to think that the SAFE Act was the answer to Sandy Hook. The governor called for more national gun control after what happened in Oregon last week. What do you say to the governor on that, Senator?
Well, again, I think that we're missing the root problems. I think that we have to address this mental illness problem. We have to address some of the other issues that surround this. And it is a constitutional right to be able to keep and bear arms. It's the Second Amendment. And you should not infringe on law-abiding citizens and their constitutional rights. So I really think that if you address gangs, if you address terrorism, and if you address mental illness, you can greatly reduce a lot of the gun violence that has occurred across the country.
We've been talking with State Senator Kathy Young. Just about out of time, Senator. Was there anything I did not bring up that you wanted to talk about?
No, I don't think so. I mean, it's been an incredibly busy time, and we've got a lot of very positive things happening. We'll be starting up session again in January. One of the things that I'm really, really excited about is the fact that we've been able to increase education aid. So we were able to put another $1.4 billion into our schools this year. One of the issues that we've been grappling with has to do with the gap elimination adjustment, which was put into place when Senate Democrats took over the Senate in 2009 and 10. And when they did that, it meant that all of state government was controlled by New York City. And as a result, it was a disaster. And one of the things they did was take money away from our schools through the gap elimination adjustment. We've got that nearly almost gone. It's about 94% gone in my district. The Senate Republicans actually prioritized helping the rural schools first. And I think that's very positive. The other thing is I've been working on telehealth, and we've been able to get telehealth services going, which brings a whole new element to health services, access to health care in rural areas. And with telehealth, for example, if you have a very complex disease and you can't travel to another part of the country where the experts are, we can, through telehealth and telemedicine, bring that expertise to your local doctor by consultations, through technology, that kind of thing. It's very, very exciting. We've also expanded it. I expanded it this year to teledentistry because I think dentistry and dental services is really an issue that we need to take a look at. In rural areas like ours, we're underserved, and that's why I established a pilot project with the University of Buffalo Dental School to actually bring dental services to our school children. And we have a mobile dentistry van that goes to the schools and checks the children and can provide services. Basically, it's UB dental students providing the services with supervisors who are actually dentists. And it's been a phenomenal program. And I think if you start those good health habits early, they can be carried throughout the person's lives, the people's lives.
Okay, State Senator Kathy Young, want to thank you very much for joining us today.
Well, thank you, Brian. Always good to speak with you.
State Senator Kathy Young, she represents Allegheny County, Livingston County, Chautauqua, and Cattaraugus. Thanks for joining us.
Thank you.